Imagine this for a moment. It's early morning. The house is quiet. The kettle has just finished boiling. A woman in her late 60s is standing in her kitchen, doing something she's done thousands of times before, making her morning coffee. Nothing feels wrong. No pain, no warning. And then, without explanation, the cup slips from her hand. Not because it's hot, not because she's distracted. Her fingers simply stop listening to her brain. She tries to call out to her husband in the next room, but the words come out tangled, broken, unfamiliar. Her face feels heavy, almost numb, like it's pulling downward on one side. In that instant, her body is sending a message that most people don't recognize until it's too late. She is having a stroke. Now, here's the part that matters. Before the ambulance siren could be heard, before a single medication was given, before any scan, any hospital bed, any specialist, she did something incredibly simple, something that most people have never been taught, something so counterintuitive that later, in the emergency room, the physician told her family it very likely protected her brain from permanent damage. She didn't take a pill. She didn't attempt anything dramatic. She didn't panic. She adjusted her body position and slowed her breathing in a very deliberate way. What she understood, and what most adults have never been told, is that the human body has an internal emergency survival system, and when it's activated correctly, even for a few minutes, it can help keep oxygenated blood flowing to the brain when every second counts. In the next few minutes, I want to explain exactly what she did, why it worked, and why this knowledge matters far more than most people realize. Because here's a sobering truth. Every 40 seconds, someone experiences a stroke. And yet, what almost no one talks about is this: the first 2 to 3 minutes before paramedics arrive, before hospitals intervene, often determine whether a person walks away, speaks clearly again, or lives with lifelong disability. Those first minutes carry enormous power, and today, I want you to understand two critical things every adult over 60 should know. First, the subtle warning signs your body sends just before a stroke fully takes hold. And second, the simple, research-supported positioning and breathing method that can help preserve brain blood flow while emergency help is on the way. This is not folklore. This is not internet advice. This comes from modern neurological and cardiovascular science, and it's something you can learn right now. To understand why this works, you need to understand what's happening inside the brain during a stroke. Most people imagine a stroke as an instant collapse, lights out, total shutdown. That's rarely how it begins. In many cases, a stroke starts quietly, almost politely. Think of your brain like a vast city at night. Millions of lights glowing, all powered by a constant supply of electricity. Every thought, every memory, every movement depends on blood delivering oxygen through extremely delicate pathways. Now imagine one of those pathways narrows or becomes partially blocked, even for a few seconds. A small part of that city goes dark. Sometimes the lights flicker back on. That's what medicine calls a transient ischemic attack, often dismissed as a mini-stroke. But there is nothing mini about it. A TIA is your brain pulling the fire alarm. It's a warning that a major stroke may be moments or hours away. And this is where the danger truly lies, because many people ignore these early signals. An arm suddenly feels heavy. A leg doesn't move quite right. Words vanish mid-sentence. Balance feels off, then returns to normal. The symptoms fade, so people brush them aside. They assume it was fatigue, dehydration, stress, or standing up too quickly. But those aren't random glitches. Those are distress signals from your brain. Inside the blood vessels, a clot may have formed in the neck, the heart, or traveled upward from hardened arteries. When it interrupts oxygen delivery to the brain cells begin to suffer within minutes. Here's the critical part most people never hear. In the earliest moments, before the blockage becomes complete, there is a narrow window where the body can still compensate. Blood flow hasn't fully collapsed yet. That window is where simple positioning and breathing can make a real difference. This is where time can be borrowed. The warning signs should never be ignored: sudden weakness or numbness on one side of the body. difficulty speaking or understanding simple words, a face that droops on one side as if half of it stopped responding, sudden vision changes, dizziness without a clear cause, a severe headache that appears out of nowhere. And here's what catches most people off guard. These symptoms can last just 60 seconds and then disappear. When they disappear, people relax. They think the danger has passed. It hasn't. When symptoms fade, it doesn't mean you're safe. It means the clock has started. Many older adults were raised to endure discomfort quietly. You don't complain. You don't make a fuss. You push through. So when something feels off, they hesitate. They don't want to bother anyone. That quiet strength, admirable in many ways, can be dangerous during a stroke, because the difference between acting immediately and waiting just a few minutes can mean full recovery or permanent injury. Another challenge is knowing the difference between normal aging and real danger. Feeling lightheaded after standing up quickly can be harmless. Sudden dizziness while sitting still is not. Misplacing your keys is normal. Suddenly being unable to form a coherent sentence is an emergency. The line can be subtle, but understanding it can save a life. Now let's talk about the technique itself, the exact steps that can help protect the brain while help is coming. When blood flow to the brain is threatened, gravity and breathing become powerful tools. The moment warning signs appear, the first instruction is simple but critical. Do not panic. Panic tightens blood vessels and robs the brain of oxygen. The priority is safety. Sit down immediately. If possible, lie flat on your back. Then, elevate your legs about 12 inches using pillows, cushions, or a chair. This allows blood pooled in the legs to return to the heart and move upward toward the brain. You're using gravity to your advantage. Then comes the breathing. Slow, controlled, intentional. Inhale gently through the nose for 4 seconds. Hold for 2. Exhale slowly through the mouth for 6 seconds. This pattern increases oxygen levels, calms the nervous system, and stabilizes blood pressure. Together, leg elevation and controlled breathing help maintain brain perfusion, keeping oxygenated blood flowing long enough for emergency care to arrive. This does not replace medical treatment. It buys time. And in stroke care, time is everything. Calm breathing prevents shallow, frantic breaths that strip oxygen from the brain. It keeps the mind clearer, allowing you to call for help, remember when symptoms started, and remain still. Purposeful action replaces panic with control. If warning signs appear, the goal is not to walk it off, not to test your strength, not to wait and see. The goal is to lie down, elevate the legs, slow the breath, and let gravity help you. Now here's something deeply hopeful. The brain can heal. Even after damage, the brain is not fixed or rigid. It's adaptable. When one pathway is injured, others can learn to take over. Like traffic rerouting when a highway is closed, new routes form. This process, neuroplasticity, begins early and continues for months. Gentle movement, guided breathing, and supportive nutrition all send signals that say rebuild. Recovery doesn't require expensive machines. It begins with consistency. Small, deliberate actions every day. Nutrition matters. Blood flow matters. Sleep matters. Emotional calm matters. Foods rich in omega-3s, antioxidants, and natural nitrates help keep vessels flexible and blood moving smoothly. Movement in the morning, hydration before caffeine, gentle calf activation, all of these protect circulation. And so we return to that quiet kitchen. When the symptoms struck, she didn't freeze. She remembered what to do. She lay down, elevated her legs, slowed her breathing. By the time help arrived, her speech had already begun to return. Preparation transformed panic into purpose. This isn't about living in fear, it's about living ready, because health isn't about avoiding every crisis. It's about knowing exactly what to do when one arrives. When blood flow slows, don't panic. Lie down. Elevate your legs. Breathe slowly. Let gravity help you. Practice it. Rehearse it. Make it instinct, because in a critical moment, there's no time to think, only to act. And when you act with knowledge, your body gives you a chance to fight back. If this reaches you today, share it with someone you care about. The next life it protects may be someone you love. And let me add something I tell every patient who sits across from me with fear in their eyes after hearing the word stroke. What you do before the event matters just as much as what happens after. Your body is not helpless. It is constantly adapting, constantly responding to the signals you give it. Every breath you take, every step you make, every hour of rest you allow. These are messages sent to your nervous system. And over time, those messages shape how resilient your brain becomes when stress arrives. One of the greatest misconceptions about aging is that decline is inevitable. It is not. What is inevitable is change, and change can move in either direction. I've seen people in their 70s regain balance, speech, and clarity that doctors once thought were lost forever. I've also seen people decline rapidly, not because their bodies failed them, but because they never learned how to work with their bodies. Knowledge is not power unless it becomes habit. That's why repetition matters. That's why simple daily routines quietly save lives. Let's talk about blood flow for a moment, because circulation is the foundation of brain health. Your brain represents only about 2% of your body weight, yet it consumes roughly 20% of your oxygen. That means even small disruptions in blood delivery have outsized consequences. Over years, poor circulation doesn't announce itself loudly. It whispers, slower thinking, subtle memory lapses, fatigue that doesn't make sense. These are often brushed off as just getting older, when in reality they're early signs that the brain isn't being nourished as well as it should be. That's why I emphasize rhythm. The body responds beautifully to rhythm. Slow breathing, gentle movement, consistent sleep patterns. These aren't luxuries. They are biological signals that tell your blood vessels to relax and open. When vessels relax, pressure stabilizes. When pressure stabilizes, the brain is protected. It's not dramatic medicine, it's quiet medicine, and quiet medicine works best when practiced daily. I often recommend a brief evening wind-down ritual, especially for older adults. Not exercise, not effort, just decompression. Sit comfortably. Place one hand on your chest, one on your abdomen. Breathe slowly, letting the belly rise first, then the chest. Long exhales. This tells the nervous system that it's safe to let go. Chronic tension constricts blood vessels. Calm expands them. This is physiology, not philosophy. Hydration deserves more attention than it gets. As we age, the sensation of thirst becomes less reliable, yet blood becomes more concentrated when fluids are low. Thicker blood doesn't move as easily. Even mild dehydration can increase stroke risk. A simple glass of water in the morning and another mid-afternoon can meaningfully improve circulation. It sounds almost too basic until you realize how many people skip it every single day. I also want to speak directly to caregivers and family members for a moment. If you notice sudden changes, confusion, slurred speech, imbalance, facial asymmetry, do not debate. Do not wait. Do not ask them to try again. Time lost is brain lost. While emergency services are on the way, help them lie down, elevate their legs, and guide their breathing. Your calm becomes their calm. Your clarity becomes their anchor. There's something else that rarely gets discussed, and that's emotional stress. Prolonged stress keeps the body in a constant state of alert. Cortisol stays elevated. Blood vessels stay tight. Over years, this wears down the cardiovascular system. Joy, laughter, connection. These aren't just pleasant experiences. They are protective. They release chemicals that widen blood vessels and improve flow. This is why socially connected seniors consistently show better cognitive outcomes. The brain thrives in safety, not fear. And let me say this clearly, prevention is not about perfection. You don't need flawless habits. You need consistent ones. A short walk most days, slow breathing every day, real food most of the time, enough sleep to let the brain repair itself. These small choices compound quietly, just like interest in a savings account. One day you look back and realize you've built resilience without even noticing. I want you to imagine a future version of yourself, steady on your feet, clear in your thinking, confident in your body's signals. That future isn't created by one big decision. It's created by hundreds of small ones. the choice to pause instead of panic, the choice to rest instead of push, the choice to listen to your body instead of dismiss it. And if a crisis ever does arrive, remember this: preparation changes outcomes. When the body recognizes a practiced response, it doesn't freeze. It follows the pathway you've already rehearsed. Lie down. Elevate the legs. Slow the breath. Call for help. Let the system do what it was designed to do. This is not about fear. This is about confidence. This is about dignity. Aging does not take power away from you. It asks you to use it differently, with awareness, with patience, with intention. Your body is not fragile. It is responsive. It listens. And when you work with it, even in the most critical moments, it will fight for you. Stay aware, stay calm, stay prepared. That's how you protect your brain. One breath at a time.